Hello, everyone. Today we will be discussing if telehealth technology threatens the future of special education and ABA. We will talk about the pros and cons of providing ABA services through telehealth and how they impact parent and child outcomes. Taking part in our debate today is myself, Denise, Hannah, Mallory, and Jasmine. Each person will discuss the pros, cons, and research behind certain topics directly related to telehealth and ABA. We will first provide an overview of telehealth and ABA. Then we will talk about accessibility, clinical quality, client dignity, and parent training, and how they're impacted by the use of telehealth services. We have included visuals and graphs to help support each topic, and we will provide explanations of each. At the close of our debate, we will pose questions in regard to telehealth services and will provide responses to each question. We hope that this debate will give you a better understanding of this topic and help you to formulate your own questions on telehealth therapy and the future of special education and ABA. Telehealth and ABA. Telehealth has been used to provide behavioral analytic intervention to individuals with autism spectrum disorder since the early 2000s. Since the COVID-19 pandemic, telehealth has become a more common practice for those involved in the world of applied behavior analysis, ABA, and it has become increasingly more popular. It has been found to be successful in training caregivers and has led to improvement of client behavior. Telehealth is a means of delivering services to clients when the telecare provider and telehealth provider and client are in different locations using internet or communication technologies. In this context, with a telehealth model, practitioners of applied behavior analysis, or ABA, may be considered healthcare providers. Telehealth is not an intervention itself, but is more so a way of delivering evidence-based interventions. There are multiple telehealth service delivery models that are used. Some models include, but are not limited to, caregiver-mediated, partial telehealth, or telehealth direct. There are multiple factors to look at when choosing what service delivery model is best. Some things to consider are client characteristics and needs, the caregiver characteristics, treatment and intervention type, and technology. For example, when considering the delivery method, it is beneficial to look at prior history of the client in regards to behavior reduction methods, skill acquisition procedures, caregiver profiles, and modifications that may need to occur in regard to the telehealth platform, and technology support needed. Many need to occur in regards to the telehealth platform, and technology becomes extremely important when it comes to that. Many researchers have discussed if there should be minimal competencies for participants and or experience levels of the people that are implementing these interventions. Although there's not sufficient research at this time, or not enough at this time. Specifically, to benefit from telehealth, it has been suggested that participant prerequisite skills include clients who can remotely participate with limited assistance and can attend to a screen for at least 10 minutes, can demonstrate joint attention, can demonstrate basic discrimination skills, can demonstrate imitation skills, including echoic repertoire, and can cooperate with one-step directions and emit low levels of problem behavior. It has also been suggested that practitioners consider whether caregivers can safely manage their problem behavior because they won't be able to attend, obviously, from a different place. There is empirical support for telehealth as an effective platform for delivering ABA services, but there are many subtopics to consider when looking at telehealth as an umbrella term. Some factors to consider include the costs, the training of the people who are implementing these interventions in telehealth, technology considerations, education and experience of people implementing the telehealth. Of course, HIPAA is a huge thing that comes up often. The prerequisite skills of the participants, the cognitive ability of the participants, and the skills that are actually being targeted during those telehealth times. Some skills that are commonly focused on while delivering the ABA interventions through telehealth services include teaching verbal behavior, self-care skills, and imitation. It would be important to consider prerequisite skills that are sufficient and necessary to benefit from telehealth services, the conditions under which telehealth may be effective, and relevant caregiver repertoires for telehealth to be reviewed to guide practitioners and stakeholders in telehealth service delivery. On the next side, it has the cumulative publications of telehealth. So obviously, due to the COVID-19 pandemic, a lot more research has come out in regards to telehealth and the benefits of telehealth. So if you look at the graph here, it has the number of publications that occurred, and then on the bottom axis, it has the years that they occurred in. So if you look at 2005 to 2020, obviously when around 2019 was when the pandemic began, into the year 2020, the amount of publications increased significantly so. So years ago, there wasn't as much research out, as there is today. But obviously so, as, we've gone on in time, there's much more research in regards to using telehealth for ABA and special education.
Thanks, Nicole. I'm Mallory, and I'm going to be talking about accessibility. So first, let's discuss the pros of accessibility. One of the benefits of the utilization of telehealth is that it allows for accessibility to those that would be unable to access these services otherwise. For example, many individuals do not have a BCBA or ABA provider within distance of where they currently reside. This could be due to them either residing in an area where the closest BCBA is miles away, or they live in a small town where there's only one BCBA available, of which is at the max capacity for their caseload to be able to assist with the number of autistic children within this small town. Another reason that individuals might not have access to in-person services is due to coming from a lower socioeconomic status, or because they fall into an underrepresented racial and ethnic minority. This is where telehealth can be beneficial to those individuals, as it allows families to still access services through this model and for behavior analysts to actively seek out these individuals to be able to provide them services. In a study conducted by Lee et al. In 2014, they found success in being able to provide services to families that were up to 200 miles away. Because of the accessibility of telehealth, they were able to service over 20 different families, and they were able to receive coaching from behavior analysts directly from their home. One of the 4 foundational principles of the Ethics Code is that we should be working towards benefiting others and protecting the welfare and rights of our clients above others. By allowing clients to receive services that they might otherwise not be able to access, we are able to continue to benefit others and provide this service, meeting this principle of the Ethics Code. Another benefit of the utilization of telehealth is it helps to reduce overall costs that go into providing ABA therapy. In a study conducted by Lee et al. In 2016, they compared and contrasted the cost of ABA by evaluating the cost of in-home therapy, clinic-based telehealth, and home-based telehealth to see how much of a factor this would play and which one is the most cost-effective. Upon conclusion of the study, they determined that the costs were lowest for home telehealth, but that in-home ABA therapy was actually the most expensive of all 3 models. This directly supports that telehealth can allow ABA providers to still provide services to autistic individuals, but at a lower cost than having to provide the therapy through an in-home model. Next, let's discuss the cons of accessibility. On the flip side that telehealth might allow for accessibility in certain situations or populations, there are also many barriers that come along with a telehealth model that actually make it either not easily accessible to others or it's completely inaccessible to certain populations. For example, in order to provide telehealth services, you must have the proper technology to allow for smooth delivery of services and to remain HIPAA compliant while providing this medical service. Not all families are going to have access to this technology that is required to receive telehealth services. How will they then be able to benefit from this model, and does this hinder them altogether from having this option of this service modality? In the same study conducted by Lee et al. In 2016, they directly addressed that there are several barriers when trying to get the proper technology to deliver this service. They mentioned that there are several pieces of equipment that would be required to ensure that you have a firewall and encrypted connection, a laptop or a computer that has an Ethernet cable, and the computer would need to have antivirus software installed onto it. Another barrier was ensuring that the internet speed had a fast connection to ensure that the call wasn't constantly lagging throughout or so that the call didn't drop completely. All of these factors might be able to be addressed by the center providing this equipment to the family. However, the cost of providing this to a family would quickly add up and be quite expensive to provide to each family they would like to service. You would then have to evaluate if you could only provide telehealth to families that could accrue this cost themselves, at which point you would have to decide if this is ethical to only take on families that already have this equipment. This directly ties to 1.08 of the BACB Ethics Code for Behavior Analysts, as it directly states that behavior analysts should not discriminate against others. In this situation, by choosing to take on clients versus others based on the equipment that they're able to provide themselves would allow for discrimination to occur, since not every family would have access to this equipment for multiple different factors. Here is a visual representation from the Lee et al. In 2016 study. You will see them comparing and contrasting the different technology needs that are required depending on the location that you're trying to service your clients. As you can see, there are different equipment needs that will be required depending not only where your client is trying to receive their services, but also where their provider is trying to provide the services from. This allows you to compare and contrast how much equipment might be needed depending on the location. For example, on the clinic to home services, you can see that this requires the most equipment for the client and the provider. But even with the clinic to clinic, there are still many pieces of equipment that are required to provide this service effectively and in a HIPAA compliant manner. This shows that technology can be a barrier to the accessibility of providing this service modality. In a literature review conducted by Ellison et al. In 2021, they evaluated 55 different studies on the use of telehealth. Within this literature review, they wanted to evaluate the requirement of access to technology for each individual study to compare the differences across studies. When evaluating this, they found that 21 of the 55 studies were able to directly provide the equipment to the families for anything that was necessary to complete the telehealth service. And only 10 of the studies did a clinic, center, or school already have the equipment that was required to provide this service. And lastly, the remaining 24 studies required that the participants have their own technology and equipment to access the telehealth service. This shows the imbalance that likely often occurs when it comes to telehealth services being accessible to all families and clients, as almost 50% of the studies within the review required families to already have the necessary equipment. Families of a lower socioeconomic status might not have the funds to be able to access this equipment and then therefore would not be able to access this service modality at all compared to those of a middle or higher socioeconomic status.
Awesome. Thank you, Mallory. So I'm Jasmine, and I'm going to be talking about the clinical quality of telehealth. So our pro of clinical quality, one of the main ones is caregiver assistance, but a lot of the benefits to the clinical quality of telehealth actually touches on a lot of other aspects that we've already talked about or that we will talk about later. For example, the clinical quality of the therapy improves in some telehealth sessions, especially those that are indirect, as in the parents are actually the primary interventionists, and the RBT or the BCBA are actually giving instruction due to parent involvement. In a study by Colt Pickard, excuse me, and Studler Brown that aimed to report the use of telehealth in the state of Colorado, an administrator who participated in the study stated the following: the therapists are actually really liking telehealth because it gets to the parents, it gets the parents and the families more involved because it's one-on-one, and the parents had to actually sit down and work with the children. And then talking to the parents, the providers actually like the telehealth because it doesn't feel as though someone is just coming in and working with their child while the parents just sit on the couch and watch. Parent involvement is a huge factor in therapy overall for ABA, and this is a massive win for telehealth. Another pro of telehealth is the flexibility. In the same study, when asked about the benefits of telehealth, there was a consistency in the mention of flexibility provided by telehealth overall. Some participants mentioned that the ability to have visits during a family's typical routines, such as dinner time, when it might be difficult for a provider to attend in person, and that telehealth would allow them to have more visits during the day because the drive time was reduced. One administrator said that telehealth adds flexibility. The family focus a lot more on dinner. They've been able to actually have the iPad at the dinner table and focus more on real life skills rather than being distracted by what else might be accessible through their technology, such as iPads, games, and things such as that. Finally, there was mention that telehealth would allow them to deliver services in the event of illness or poor weather, which is a huge factor for families and therapists that could be single parents or caregivers that have other children, or either the therapists or families that are on their own. All of these doors that telehealth opens for families and caregivers and increasing the clinical quality of intervention, as well as contribute to BCBAs being able to provide effective treatment, as in the Ethics Code 2.01, and it can be argued that 2.08, communicating about services, can also be improved through the help of telehealth. Now I'm going to focus on the cons of clinical quality and some barriers that might be in place. In a study of practitioners, BCBAs, BCABAs, and their experiences in the use of telehealth during the COVID-19 epidemic, participants spoke about barriers related to the use of internet technology and video conferencing platforms, and how telehealth services did not contribute to the increased clinical quality of the intervention, but actually the opposite. And here are the four main issues that were listed. Number one is that the industry was rushed into the use of telehealth in March of 2020 because of COVID. There was no choice. That was the only option in order to continue services, and it might have been unethical to not continue services due to illness. Number two would be logistics of equipment use, which touches on some other things that my other partners might have mentioned. Access to technology, how to use the technology would be a big issue if they weren't properly trained. Number three would be interfering with aspects of the client's environment or remote viewing. And number four, the practitioner's ability to help troubleshoot problems for the clients. In the same study, one administrator stated, "You have to spend quite a bit of time on the front end, getting everything set up and testing and doing all of that for people. The known in-person therapy is more efficient and more comfortable than the unknown, telehealth. And families don't always have the technology that the initial setup could be really challenging." One participant emphasized the rural families who would benefit most from telehealth are also the ones who have limited access to internet connections. They noted that the telehealth with the EL system currently needs to be delivered over a secure connection. This rules out more accessible video conferencing platforms that a family could access using cellular data from their phones. For example, a provider indicated, "I don't use it because most of my families don't have a computer with a secure internet connection." This is a huge downfall of telehealth services, and this also causes an issue in the Ethics Code 2.03, 2.04, and 2.05, all of which have to do with client confidentiality, information and documentation protection, and retention. Here I've included a table from the same study that provides themes, frequencies, and representative examples for respondents' telehealth delivery experiences. The two most mentioned comments from this section were caregiver involvement and reduced travel times, which further supports the data from previous studies and other mentions. But further down the list of themes, it is also represented that in-person strategies are not transferable and lack and lack of technological support are the two highest mentioned themes. Not being able to use in-person strategies in telehealth sessions is a massive roadblock to effective treatment and therefore a con of clinical quality in telehealth.
Hello everyone, my name is Hannah and I will be discussing the pros and cons of client dignity through the use of telehealth. A benefit that contributes to a client's outcome by using telehealth includes allowing the client to receive services in the comfort of their home and being able to avoid physical contact with other individuals. Many individuals feel overwhelmed with going into waiting rooms, whether it be due to environmental stressors, the risk of getting sick from others in the waiting room, or even fearing that other individuals in the office can hear what is being discussed. For example, the lighting may be too bright in the waiting room or overly crowded, which can cause the client to feel a high level of anxiety before they head into their appointment. Telehealth can help combat those barriers by allowing the individual to be in control of their environment that they receive services in. In a study conducted by Harris et al. In 2022, examined the advantages and disadvantages that telehealth provides in adults who have autism spectrum disorder. In the study, there was a total of 19 participants over the age of 18, of whom 12 of them were caregivers and 7 of them had autism. The procedure consisted of asking the participants a series of questions regarding telehealth visits versus going in person for visits and any contributing reasons why they preferred one over the other. This study discussed that participants expressed that using telehealth allowed them to feel relaxed and less anxious due to not having to wait in the waiting room or making a long commute to make it to the office. In addition, participants felt more at ease talking through a computer in their home because there is not that sense of intimidation of standing in front of a person. Another benefit that using telehealth can produce is a sense of feeling safe, especially in the sense of getting sick from other individuals. The study conducted by Harris et al. In 2022 showed that participants found using telehealth helps to avoid catching any illnesses that can be contracted by going in person while still being able to receive the services that they need. The findings of this study indicated that telehealth visits allow the participants to feel more comfortable about receiving services because they're able to have control of their environment that they receive services in, including environmental distractions and reducing in-person interactions that occurred. Although telehealth may not help every individual, including those of an older population, it can become more of a useful tool in the ABA field with further research and implementation. Although telehealth can allow the individual to feel comfortable in the environment of their home, it can propose different barriers that need to be considered. One disadvantage that comes with telehealth is it can pose a risk to a client's confidentiality and privacy if not properly approved by HIPAA. An example of this that was given in an article by Romani and Shields in 2017 was Skype, which is not approved by HIPAA and poses the risk that information that is discussed over Skype can be accessed by outside sources. A study that was conducted by Romani and Shields in 2017 looked into the use of telehealth and the ethical issues that can come up with the use of it. The first drawback that was discussed was a technological issue that can occur, ultimately affecting the session. Issues that were mentioned in the study was the internet connection was lacking, the internet connection becoming totally lost, the screen to freeze, or eventually just causing delays. In addition, there was a portion of the study where the camera was flipped in the wrong direction, which resulted in the behavior analyst not being able to correct the technological issues. Another drawback to using telehealth is that it is all based on vocal communication, which makes it lack the physical cues that we are able to pick up in person rather than online. An example of this in the study by Romani and Shields in 2017 is that with telehealth, a caregiver or the client may not be able to follow and understand vocal instructions and cues given by the BCBA, which can limit the effectiveness of the treatment. In addition, it may be hard for the BCBA to distinguish over the webcam how the individual is feeling, whether he is anxious or frustrated due to the quality of the webcam or how the camera is angled. Although technology issues can be fixed or altered, it is important to stay mindful of them and up to research of the ethical issues that can occur, such as the ones that were just discussed. In the study by Harris et al. In 2022, it discussed the benefits that the use of telehealth can produce. The diagrams that are provided above highlight the main advantages of the use of telehealth that were discussed in the study, including increased patient comfort, increased safety, and better communication overall. With each advantage is a statement that was mentioned by each participant that gives their firsthand experience with the use of telehealth. An example that was given from a caregiver in the study was, "I was able to talk to them the same as I would be in person." These statements help to supply support to each advantage and give firsthand experience. In addition, the first chart attached gives the ages, sex, race, and ethnicity of the participants in the study to help further evaluate the study and the outcomes. In the study by Romani and Shields in 2017, it discussed the barriers that can be caused by the use of telehealth in individuals with autism spectrum disorder. The chart that is attached below was used in the study to help show the ethical codes and themes that facilitate or raise a concern with the use of telehealth. Following ethical codes is an important aspect in being in a BCBA and in the field of ABA, which makes this chart beneficial when introducing the use of telehealth to clients. An example of an ethical code that can raise concern for the use of telehealth that is shown on the chart is 2.06, maintaining confidentiality and making sure unknown people are not being able to access clients' sessions.
Thanks, Hannah. Hi, everyone. My name is Denise, and I will be discussing the pros and cons of offering parent training delivered through telehealth. The first advantage of parent training through telehealth is that parents get to be involved and they get to learn. When ABA is delivered over telehealth, parents get to be involved and receive the opportunity to help their child improve behaviors while learning ABA strategies. Some strategies that are taught to parents virtually include functional communication training, requesting, joint attention, preference assessments, and differential reinforcement procedures. Offering ABA services through telehealth allows parents to play an active role in their child's therapy, reducing challenging behaviors and also increasing many positive behaviors. One of the main advantages of parents receiving coaching through telehealth is that effects are often greater and more durable since the parent plays a key role. Training over telehealth gives parents access to the behavior intervention all the time and allows the parent to learn in their natural environment while using their own materials at their house, and allows greater generalization of child skills across all settings. In addition to this, parent training offered through telehealth can increase parent confidence and lower their stress. As parents learn more during telehealth sessions, they will become more skilled, leading to lasting behavior change over time and also improve child outcomes. Most importantly, parents will receive natural reinforcement knowing they were the reason for their child's behavior change. Since parents are the main ingredient to successful delivery of ABA through telehealth, they will more likely become more confident, become more comfortable dealing with challenging behavior, and even more competent in their parenting abilities. The last advantage of parent training through telehealth that I will talk about today relates to the feasibility, acceptability, and accessibility of ABA parent training. Using telehealth for ABA services and parent training is safe, it eliminates waitlist times, it's flexible, it's individualized to the family, and it's also preferred by many parents. Parents can also easily learn how to address their child's behavior in the comfort of their own home. They don't have to travel to a clinic, and they reduce travel costs as well. So to support the pros associated with training parents through telehealth, I will discuss some research behind that. Some studies have shown that parents who receive training through telehealth can effectively implement ABA strategies with high fidelity and can improve their child's outcomes as well. The study by Giroux et al. Evaluated the outcomes of ABA delivered through telehealth to parents. So in the study, there was 30 parent-child dyads who participated in the study and received ABA coaching through telehealth. Parents were taught to implement strategies such as naturalistic teaching, prompting, discrete child training, and total task training, also differential reinforcement procedures as well. And the result of this study show that parents accurately implemented the interventions with 95% accuracy. So they also found that children also improved on their goals and the parents rated the delivery of coaching very favorable. Here are some graphs that were shown in the Giroux et al. Study. These are ABA graphs pictured here that show the effectiveness of the parent training delivered through telehealth. After the parents participated in the coaching sessions and implemented the strategies that they learned, their child's outcomes significantly improved, as you can see by the graphs there. But the children improved significantly on 3-word requesting, putting on their shoes, engagement in functional play, and they showed a decrease in challenging behaviors. So this supports the effectiveness of parent training through telehealth. And on to the cons of parent training. We also believe that there are many reasons why special education and ABA services are negatively impacted by the use of telehealth. When providing parent training over telehealth, parents play a huge role in the successful delivery of the services. Though a disadvantage of telehealth parent training is that the parent always needs to be present, available, and free from distractions. So as we know, parents have many other responsibilities in their home, like tending to other children, work demands, time constraints that may actually take away their engagement in the parent training through telehealth. Also, things like managing their child's behavior, like possible elopement from the computer screen, sitting in front of the computer, might be difficult for parents to multitask while also listening to the directions from the clinician on how to implement strategies. So if there's a lot of things going on, this could lead to not hearing the directions and feedback from the clinician and may lead to intervention infidelity. Another disadvantage is that clinicians often have a hard time demonstrating techniques and providing corrective feedback to parents without being present in the same room. It's sometimes difficult over the computer screen. Coaching through telehealth also comes with some technological challenges, and this might include not being able to see the parent and child due to where the camera is placed in the room, not being able to see the whole environment due to like the limited frame of the camera, and possible connection issues, as we've mentioned before. So these issues may cause the clinician to miss the context of a situation and not be able to appropriately prompt them through the screen, or a missed opportunity for parent coaching. And my final con that I will argue today is that parents may become frustrated or stressed being involved in their child's treatment. Some parents may become overwhelmed when it comes to implementing behavioral interventions through the screen and learning the strategies during coaching. This might be due to the hardships of learning through the computer, trying to multitask everything, and always needing to be available for every session. This frustration and stress could actually lead to discontinuation of services and maybe lead parents to not seek out any other services if it's not available for them. And as mentioned on the slide, the BACB ethics code mentioned should be considered when providing ABA through telehealth. Clinicians should remember to maintain their scope of confidence even when accepting clients virtually, and remember to protect their confidential information and always communicate about services even while they're providing services virtually. Clinicians need to address any factors that would interfere with service delivery, like the technological issues I mentioned, and always continue to act in the best interests of the clients, even through the computer. And the research behind this is a study by Pomales, Ramos et al., and they surveyed 388 clinicians about their preferences and barriers related to ABA therapy over telehealth. And the survey asked clinicians to answer questions regarding their own experiences with telehealth, like certain barriers, the feasibility of it. And the results of the survey showed that 45% of the clinicians reported having challenges with caregiver involvement during telehealth sessions. And those difficulties included distractions, other demands, and frustration. And also a total of 57% of clinicians reported difficulties trying to implement strategies through the computer. So, however, 19 of those clinicians reported specific to coaching parents and struggles with providing feedback and prompting through the computer screen. And here is just a table that was pictured in that study. It just shows that 17 of the clinicians mentioned distractions and the competing demands while providing parent training. And there was a quote that a clinician wrote that said, "If families have multiple kids at home, it was hard to do therapy. If the parents did not want to have help during a session, they denied wanting therapy." And then this table just goes on to explain that even though there was increased caregiver participation, there were still some clinicians that had a hard time dealing with the caregivers' competing demands, and it limited their involvement. And this was just the last table I had that shows the same thing. It shows the number of clinicians that reported barriers to implementing intervention strategies through telehealth. And it shows that 19 of the clinicians specifically reported difficulties demonstrating the intervention strategies. And the clinicians specifically mentioned that giving training tips through telehealth made it difficult to give them feedback, as I mentioned previously. And it was also mentioned that guiding parents on how to prompt their children was also difficult during sessions.
In conclusion, we strongly support the topic that telehealth does not threaten the future of special education and ABA. We delivered many arguments stating the pros and cons to this topic and thoroughly examined both sides of the issue. We proved that telehealth does not impact the future of ABA by providing examples of how delivering ABA services through telehealth improves child outcomes, gets parents more involved, and is accessible to those who may not have regular access to services. We're going to move on to some questions and answers that people may have in regards to this topic. We will now discuss some further questions that will go beyond the main topic. If a company did not have any limitations to the funds that they could provide to a family in regard to the technology, does this still pose a barrier?
Great question, Nicole. While we believe that this would certainly help families access services via this modality, this also would require the company and behavior analysts to think through the BACB ethics code. In 1.12 of the ethics code, it directly talks about giving and receiving gifts. Would this then constitute as a gift that the company is then providing the family to receive a service? Would this also then fall into an area where we are crossing this ethical boundary? Or did not, because we would require the technology to be returned at the end of the service? What if the family also damages the equipment? Who would then accrue the cost of getting it fixed? And does that mean that they no longer receive services? All of these questions would have to be considered to answer this question on whether a company should ethically provide the equipment to the family and whether this resolves that barrier.
Thank you, Mallory. Does the minimal research prior to COVID, when the field was forced to implement telehealth services, have an effect on the quality of services given through telehealth in ABA?
According to Duenas and Augusto, although the field of ABA had only been using telehealth for roughly 15 years, which is a rather short time, other fields have actually been utilizing telehealth for roughly 50 years. These fields include mental health, pediatrics, geriatrics, and a field that ABA works very closely with, speech-language pathology. Many of these fields have reported multiple advantages to the tool and an increase in quality of life for the client. Speech-language pathology specifically has reported things such as increased efficiency, inclusion of family members, ease of follow-up, as well as high satisfaction from both the client and the practitioner. All of these things which we have touched on today. There's also the added point that within the last 10 years, the use of telehealth to deliver therapy based on the science of ABA has increased dramatically. The Council of Autism Service Providers has already created an outline of current telehealth service delivery models for ABA-based therapy that fit under two categories. One is direct telehealth services implemented by a trained practitioner, also known as an RBT, to a child with ASD via teleconferencing in real time, or two, indirect telehealth services where caregivers and/or practitioners are coached via modeling and feedback to deliver interventions by trained professionals.
Thank you. Does the implementation of telehealth ABA services provide the same outcomes for international parents and families of different cultural backgrounds?
That's a great question. We believe that providing parents training to implement ABA strategies through telehealth to those who live internationally and have a different cultural background is effective. One of the advantages of telehealth that we have discussed today is that parents who do not have regular access to services in their area now can access ABA virtually and receive the needed resources. Ferguson and colleagues conducted a study to determine if coaching international parents and their child through telehealth was effective for increasing the skills of parents and using naturalistic teaching, and also for increasing their child's language development. So one parent dyad in the study was originally from Latin America and spoke Spanish, and the other parent dyad was from East Africa, but they currently lived in Germany for the study, so sessions were done in Germany. In this study, the practitioners coached parents through telehealth, how to implement different strategies during play with their child to increase communication. Some of the ABA strategies parents learned to implement were prompting, reinforcement, following the child's lead, and establishing eye contact. And parents were provided with corrective feedback during the telehealth sessions. And they found that the results of this study show that parents were able to implement the programming with high fidelity, geographical and cultural differences did not impact their learning, and both children increased their verbal communication.
Thank you. If the individual receiving telehealth services is under the age of 18, is parent consent required? Yes, you'll need to sign an appropriate separate consent form for any type of telehealth service delivery model. So we spoke about earlier the 3 different service delivery models that you see more typically in telehealth. So for any model that is used, you will have to receive consent if the child is under the age of 18. So a parent or a guardian will have to sign consent for that. Typically, you want to include the background on the risks and benefits of the services that you are delivering through any modality that you are using. And then I believe we skipped one. I want to go back. Does the use of telehealth decrease concerns for ethical codes that will help improve client dignity?
Yes, the answer is yes. Telehealth does decrease the concerns for ethical codes that will help improve client dignity. In a study conducted by Romani and Shields in 2017, provided multiple ethical codes that use telehealth to help decrease these codes. Ethical Code BACB 106 and APA 306 states that all multiple relationships should be avoided and be aware of the harmful effects that they can cause. In this study, it showed that the use of telehealth can decrease this ethical code because there is limited to no social interaction in person.
I believe we covered all of the questions. Okay. And then you'll see going forward, we have some references here in regards to the articles that we use throughout our debate.